ಶುರು ಮಾಡಬಹುದು.
Namaste everyone. This is Harish from Youth for Seva Bangalore team. I welcome everyone for this an informative session on the current challenges that we have around in terms of health, Omicron, COVID. There are many questions that most of us had. What is this all about? So what should I do? What preventions I can take care? Or what is the severe or what is the mild thing? So these are the basic questions that we would have before meeting, consulting a doctor or taking their advice. So from Youth for Seva and Doctors for Seva jointly, we wanted to help or share our knowledge on this pandemic and these challenges with all our volunteers and well-wishers. So that is why the session is being organized for the benefit of all of you and many more that will be joining us or watching it on the live stream. So I welcome everyone for this session once again and request, we have Dr. Jyothilakshmi with us, who is the speaker of the day. I would request our DFS coordinator, Ms. Arpita, to have a quick introduction of Dr. Jyothilakshmi, the speaker of the day. Arpita, over to you, please.
Namaste and good evening to everyone. I am Arpita from Bangalore, currently doing a fellowship with Doctors for Seva. I consider it my privilege to introduce you all to today's speaker, our very own Dr. Jyothilakshmi ma'am. Dr. Jyothilakshmi K is a family physician from more than 20 years. She is a volunteer at Youth for Seva from a decade and president of Doctors for Seva for 2 years. Some of her works include, during the lockdown period, she's joined the task force to help citizens to cope with the fear of COVID-19. She's joined Step 1 to help COVID-positive patients through telemedicine across India. She was involved in the counseling for Bangalore South Police during the stressful pandemic time along with the task force. She was also a part of the medical team at a triathlon organized for Fit India. She had also anchored the health screening of SSLC students during the COVID period, which facilitated smooth running of exams. And she has conducted about 30 plus webinars on COVID-19 awareness. And here we have such one webinar too. A hearty welcome to you, ma'am.
Thank you. Thank you, Arpita.
Yeah, thank you, Arpita. That is a short introduction, though ma'am has done so much to the entire world and society and been very, very active and concerned about all of our health. All the full-timers, all the volunteers, whoever reaches to madam with a concern. And even if we don't call her the next time, she'll call us back and find out how are we doing. We are following all the precautions that are being suggested. That's really great of you. With that concern, again, she is here with us to help us all to understand the challenges of the need or the precautions that we all will have to take. Without any delay, I open the forum for you, madam. So please.
Thank you. Thank you. That was a wonderful introduction of me. And welcome you all. Good afternoon to everybody. Rather, it's becoming evening now, 5 o'clock. Then thanks to YFS, thanks to my parents, my family, my siblings, everyone for which I'm here. This is an opportunity. I feel that whatever knowledge I have gained from all seniors from my forum, it's not my own opinion. Now, whatever I'm going to talk to you people regarding Corona, the third wave, and this mainly from many branches wherever I am here, like Project Step 1, my seniors, IME, and then ICMR, WHO, then Family Physician Associations, wherever I have got the information, I've got the knowledge. It's always a pleasure to share my knowledge to people, especially my family. I consider YFS volunteers and coordinators as my family, and that's what I was telling Harishi. My family, yes, I should take care of my family, and I feel as a doctor, it's entire medical fraternity, even all of us feel that it is our duty to see you all safely to the exit of this pandemic. That's what I've been telling since 2 years, and we are trying to do our level best, and hope this will benefit you all. And just listen to some short presentation I have made, and later on you can ask some questions, whatever you are having. So coming to this, the first thing is the third wave for real? Has it arrived? Most of us are still thinking, no, we have not arrived. Most of them tell that, no, it's that, where is Corona? Still, it's not there. Many people want to deny that we are not into this, but of course, it is already all over the world and India too, and it is spreading with each eye blink. We are having more and more cases being added to the number, and I think today it is more than 1 lakh in India. We are having COVID cases. So is the third wave just hype or hope, or really it is very scary? That's what we all think. There was, it is not at all a hype, not at all, because it's for real and the numbers are very much high and it is at our doorsteps. The hope is most of them, like we or the seniors, are also believing that this is a hope that it is going to wipe off the COVID completely, but we do not know. Only time can tell us. Next mutation can be much lesser than what it is now, or maybe dangerous. We do not know. So scary is the numbers are really, really scary, despite the number, the severity being lesser than the previous variant. So coming to the variant, exactly. Yeah, all viruses have the property of mutation. They undergo mutation, and when they find a very comfortable host, favorable host, what we call, they go into different kind of mutations that might be a dangerous one or a milder one. Unfortunately, the variant of corona, which was Delta plus, that's the second wave, was very, very serious. Whereas this third wave variant, we call it as Omicron, that is quite milder when compared to Delta plus, but the severity is less, but the infectious rate, that is the infectivity, is very, very high, highly contagious than Delta plus. That's why we are having more and more cases. What our expected numbers are really, really just huge numbers. These are like, we are expecting around 10 to 15 lakh cases per day all over India. So that can be quite an enormous number compared to the previous one, where we had, I think, 7 lakh in the second wave. Hope that doesn't reach to that 15 lakh expected. That is why I am here to tell how we can protect ourselves, shield ourselves from this new variant also. It is said that every confirmed case, there can be 5 to 30 undiagnosed or unreported cases. We are saying whatever we are having today, the number is really less. The media or whatever people think that no, media is giving a higher number, it is all hype, but definitely not. As a clinician, as a family physician, what I'm seeing, most of my patients are not getting tested because it's a mild case. By 3 days, they become all right and they don't want to do the test. Some of them are doing self-kits, which are not being reported. So what I feel is, of course, we are having higher number, but let us take care so that it doesn't become severe or huge number that we cannot tolerate. So coming, Harishji, can you please share the screen for me?
Yeah, sure.
We have heard a lot about the R values. So there are certain questions you people may be having. No? R value is for Omicron is said to be 33.5, whereas Delta it had only 1. That is, each patient can transmit the disease to at least 3.5 people immediately within some time. So that is why we have to be very careful. Yes. Yeah. So let us talk about Omicron. That is the new variant of corona only. Many people are saying, no, I've not got corona. It must be Omicron. It's mild. Omicron is a variant of corona. Delta plus was also a variant of corona. Next slide, please. Next slide, please. Harish.
Yes, ma'am. It's on the next slide only.
Next slide. No, I cannot see that. Second slide.
Okay, I'll share it again. 1 second. Is it visible now?
Yeah, but next slide.
Make it as a slideshow.
It is. Still not visible. I'm moving to the next slides only. Okay, 1 second. Give me a second.
We have learned very tough lessons in the last 2 years. I think the COVID-19 is coronavirus detected in December. But fortunately, I always say that India has been 2 months behind, 2 to 3 months behind other countries. So we get to know much about the virus, the symptoms, and even the treatment and the severity of the infection too. So considering those things, that is why we have come to different kind of guidelines every time some new virus is coming. And many people ask me, how is it only for 7 days? So definitely the infectivity has come down to 5 to 7 days, which was earlier about 10 to 14 days. And the incubation period also is 2 to 14 days for Omicron.
Is it visible now?
Yeah, next slide, please. Yeah, these are just some numbers we wanted to show you, not to scare you, but this is the June 22nd when we had this first wave. The doubling rate went in 33 days. It was doubled, whereas in wave 2, the doubling rate was quite early by 8 days itself, and in the wave 3 we have seen it is around 3 days. Still, it has not reached the 7 lakh. But might reach if we are careless now, until and unless we take some precautions and try to stop the transmission. Definitely, we are going to see 15 lakh, whatever the expected number we have seen. This peak might go up. Though it is the disease is mild, what I feel is, considering our population about 148 crores, if even if the mortality admission is around 1%, it can come up to even, I consider 100 crores being, getting infected. We can say around 1 crore people might need admission. And 0.5% is the mortality. What is a big thing? It's not a big thing. Everyone says, but it's not so. People who have lost their near and dear ones definitely know the value of death. So it's a huge number. If only like around 50 lakh people, we might expect, if at all, 100 crores get infected. Is at this rate, if this goes, we definitely are going to see that. And I don't think our healthcare system is sufficient enough to take care of that. So let us not repeat the second wave story here. So let us take all precautions and all the care about ourselves, our loved ones. Especially, we should worry about people who have not been vaccinated. Though India has seen maximum vaccinations, about 150 crore have been vaccinated, but our population is so much, and the number is including the second dose. The number is totally 2 vaccines whoever have taken is around 50 crores only. And since it is only above 15 now have received vaccinations, below 15 and the aged with comorbidities, definitely we need to take care. So coming to this, that waves, I just wanted to show the second wave was this, third wave is almost reached there and it might go up. So the next slide, please. So how do you differentiate, madam? This is Omicron or Delta plus. We are not able to understand. So there are every flu has similar complaints, like symptoms are most of the illnesses, especially flu or a viral disease, have same thing. That is a cough, cold, fever, then weakness. These will be the main thing. And if it continues for a longer time, there we see a respiratory distress also. And if it's not handled well, there will be hospitalization also. So this is a comparison thing. What we have written here is the first wave had seen loss of smell at the onset itself, whereas second wave we have seen almost at the 9th or 10th day we have seen loss of smell and loss of taste, which was a very the sign to say that it is COVID. Most of the time, people who would say we have lost smell, so I would tell them no need to do the test also sometimes, because they have already reached the stage of recovery, and within 1 week they would become all right. But that was not so in the case of the second wave, where there was little partial loss or complete loss, but that took long time for them to become all right. It was seen in the early wave. Whereas in the third wave, this is the salient feature. That is the Omicron infection. How do you differentiate between Omicron and Delta Plus is no loss of smell and taste. So no patient complains of this. And they have cough and cold. It's a dry cough in all the cases, but whereas in the third wave, what we are seeing is there is a little bit of phlegm is there, very little, but it is in the upper respiratory tract infection. It is in the throat itself. It's not causing any systemic inflammations. So chest congestion is very less seen in the third wave, which we have seen the maximum in the second wave. That's why we had that SpO2 was dropping and there was need for oxygenation, oxygen cylinders, and we know how much we all suffered, get those supply, and people needed, ICUs and ventilators also. There was about 10 to 12% of admissions were seen, and fever was high grade in both the cases, whereas in the third wave, fever is low grade fever, or with, if at all, high grade, little bit chills are definitely there, but comes down within 2 or 3 days. This is the difference between all the three waves what we have seen. And so next slide says that there are the symptoms of the Omicron particularly. Next slide, please. I think the CT and blood tests are not required if it is Omicron infection. So how do I know it is a Omicron or a Delta Plus? Your disease will tell you. If a person has fever, he can just have to wait for some time. Just take a paracetamol, and the cold, this one he has, he can take some anti-allergics, get in touch with your family doctors or any doctor friends or anyone who is ready to help you, or 1075 helpline is there, Aptamitra is there. Just call them, take medicine for 2 days. If the fever is not coming down and you're developing more problems, you can go for RT-PCR test on the third day. But the first day of symptoms, please isolate yourself to protect your family. And then next comes your testing. Should be done on the third day. If you're having severe symptoms, second day also it will show. Otherwise, unnecessarily you will get false negative, and you will have to repeat the test after 5 days. So doing the test on the third day is always advisable. And after that, wait till 5th day. Third day you do the test. If it is positive, take the treatment. If it is negative, still you continue to isolate yourself for 5 days. And then if it is increasing, the fever or your symptoms are increasing, you contact another doctor and then take the medicines. If beyond 5 days it is increasing, definitely we'll have to think about Delta Plus, because Omicron, fever, everything comes down by 3 to 5 days. And any, for whatever may be, please monitor yourself, monitor temperature. And if you're having any difficulty in breathing, don't think that it is mild, I'll stay at home, because we are not testing for Omicron or Delta. Whatever RT-PCR is detecting coronavirus, Omicron and Delta can be done with genome sequencing, which is not done routinely for all, because it is very costly, as well as cannot be done for such large number, takes a lot of time also. So that is why we'll have to find out how we are, depending on our symptoms. We'll have to judge. So that's why you keep in touch with your doctors. They will tell you, they will judge about what is happening with you. And then these are the common symptoms are cough, sore throat, fever, headache. Headache is one of the major symptoms that we have seen in the third wave, which was not seen before. So then headache also without fever, I have seen a couple of cases. And there are some atypical symptoms which are loose motions also, but in very, very milder cases, very few cases, we see that body aches, body pain, generalized weakness is too much in this Omicron too. So these are the symptoms. Runny nose also will be there. But you have to continue to monitor, even if you suspect Omicron or whatever maybe, you continue to monitor your temperature and SpO2 pulse oximeter. You all know about pulse oximeter by now. So that can be, you can monitor that. And whenever it is going below 94, you will have to contact doctor. First, you have to go for a walk test, 6-minute walk test for someone below 60 years, and 33-minute walk test. If that drops, then if SpO2 is dropping after work, then you need to contact doctor. You might require, admission and further things like oxygen you might require. So the certain things, warning signals, of course, I was told, fever not coming down even after 5th day, and the body aches are more, and you might miss fever, things like dengue. So that's the reason you'll have to go for blood test after 5th day. Even if you continue to deteriorate your situation, your body condition is not improving, then you definitely need to go for blood tests and other things. But however, do not go for CT thorax, which is not required here because there is no hardly any lung involvement with the third. In the third wave, we have seen very few cases we have seen having lung involvement. And we can, roughly, I have made little differences. What we can make out is, supposing a dry cough with just sneeze, it can be air pollution also. Like you in Bangalore or Delhi, we go out and come back, we'll start sneezing because of the pollution around. That is also there. You wait, do not panic. Be prepared, but do not panic. And cough, mucus, sneeze, and runny nose, it can be just a common cold. That's why I said wait for 2 days, take only symptomatic treatment, take steaming and take do gargling, betadine gargles, and then have some hot soup or kashaya, kadai, whatever you people are doing, kada, all those things you can have, and soothing, something to soothe your upper throat. Then next is cough, mucus, sneeze, runny nose, body aches are more, bone pain kind of thing. Then you can always think it is flu or dengue. Dry cough, sneeze, body ache, weakness, high fever, and difficulty to breathe definitely can be corona. And here I would like to increased weakness. Your body tells you that you're not all right, especially when it is corona infection. So how do we prevent now? Now that you know the conditions, we all know what we have been. Next slide, please. What we have to do for prevention. It may be a repetition of what I have been talking before also, but still most of us do not do what we know. So totally there is difference between knowing and doing. I know we shouldn't be fat, but still I know I should exercise, but still I don't do it. I tell I don't do so frequently, so often. So this is what we all do, but now we can't, take that lightly. We have to prevent because prevention is better than cure. If you get fine mild, madam, what is there? Why should I worry? This is just a mild fever. Why are you scaring us? It is mild fever, but you don't know how it acts because since novel coronavirus, it's a new one for us. Since 2 years only we have observed, and every time it is changing. It is being very fickle and it is mutating rapidly. Nothing can be said about it. Whatever I am telling today might be wrong tomorrow. So that is why. But what stays here is from 2 years, what we have believed, what has helped us prevent the infection is definitely there are 5 weapons for us. That is IV, SMS, that is immunity, vaccination, and of course your SMS, whatever we have been following, are definitely 5 weapons to fight corona infection. And why this again? The third wave came. We have been thinking third wave should not come, we should not do this. Why the second wave came? I told because of all these things that we went in search of gold, like shopping, partying, traveling. The same thing happened soon after the second wave. Under resilience, what we did a binge traveling. We did a binge shopping. And some of us called it as revenge traveling. We wanted to take revenge on corona. Why is it traveling all over the world and where I am sitting at home? So we started traveling so often. Probably we have carried that to other places. From one place to another place, we have helped it, transmit from one person to another person by using public transport things and all that. And the crowding, we have encouraged crowding, rallies, and many other things we have done. So partying, we have partied like anything because I know all of us like to party. All of us like to meet our friends. Everything is right, but this is the time again we have to cut down on few things like that. Unwanted travels, Unnecessary travels we must avoid, and unnecessary visits to the hospitals also we must avoid now, unless it is an emergency. And unless you are having aged parents, try to avoid going there, because you may be an asymptomatic carrier. You don't know how you can spread the infection. They may be more vulnerable to the infection. So these are the things. And here we have forgotten the diamonds. What I said is I included immunity here. There are only 4. They are saying mask, physical distance of 2 feet, this one, and physical distance and sanitization and vaccination. Of course, vaccination should not be forgotten. And we are proud to say that we have achieved 150 crores where no other country has done it. So vaccination was good, but yet there are many people who haven't got even single dose done here. So we have to worry about them, especially the kids from up to 15 years. Still, they are not permitted to take the vaccine. Probably that will start in the next month. 12 to 15 age group also might get shortly. And definitely the mask, we have understood one thing: mask alone can prevent acquiring and spreading of the killer viruses. Here, once again, I want to remind you, corona or a COVID infection is respiratory droplet infection. It spreads through our respiratory droplets. The exit point is mouth and nose. The secretions that come out of our mouth and nose only can infect another person. When it falls directly on their mouth or nose, that can infect them, or when it falls on some surfaces where they touch that, and with those hands, if they touch their mouth, eyes, and nose, they definitely get infected. So this is another thing why I wanted to tell is because this, if we close, then there is solution. And we have shown in a few slides before also that mask is our vaccine, especially before vaccine. Mask has protected many of us and will definitely protect us, even if the government removes it as not a mandatory or whatever people say and happen, because it has happened in UK now. It's made like optional. You want to wear, you wear. Yes, I would suggest all of you to continue to wear mask for another 1 or 2 years to protect yourself. Just like how we wear helmet, we need to wear our mask. The moment we go out, put chappal and mask is a must. At home, if anyone is sick, don't go out. That's another thing. So you have to, if you want to protect your nation, if you want to protect your people, that's the best thing you can do. Then next slide, please. So double up your mask. Yes, we have been wearing mask. So most of us are wearing one mask, yes. But now we have to wear double mask. Double mask, last second wave, and also we have told double mask is one cloth mask. This is the cloth mask, and this is the surgical mask. By now everyone knows what is what, but still I'm just showing once again. And this is an N95 mask. With everything we'll have to, wear double it. Like first is a surgical mask inside, and then one more here. So this CDS reports what they say is single mask can protect only up to 50%. So if you do twice, if you are using 85 to 90%, it can give you protection from another infected person, or it will stop you from infecting other people. And not an attack surgical mask. Generally, people just put it like this, and I would like to do it like keep a knot like this, make it like this and put, then it will be tight. It will not allow anything to enter. So that is a way to wear mask. And do not wear wet mask. Do not wear dirty mask, because that has caused a lot of fungus in the last this one wave. We have seen a lot of fungus, mucormycosis. None of us can forget it. So dirty mask, you should be loose. It shouldn't be tight. It should be very comfortable for you. If you want, you can even wear a face shield. That is also very good. Helmet, most of us wear only when there is a traffic inspector is there. There was some small joke in one movie I had seen. So he says, yo, give me helmet, otherwise traffic police will scold me. Then what he says, you have to take to protect your family, not worry about your traffic police. So that is similarly, you have to protect yourself and protect your family. We have to wear mask. It is for our protection. It's not for somebody. Many people say that a doctor is coming, I will wear mask. So that's not that. It would not wear for me, but for your family. And yeah, next slide, please.
Ma'am, there were few questions. Shall we take up in the middle or at the end?
We will do it at the end. Okay. Yeah. So in this slide, double up what I am showing. I think most of the things will be covered by then, Nirupama. Okay. So this double up, whenever you do not use 2 cloth masks or do not use 2 surgical masks. That's why the into is given there. Do not use a similar kind of mask. Okay. It will not help you much. It will only suffocate you. And that's the reason we are telling mix and match. Use 2. The upper one should be washable one. The low inside one should be the disposable one. That will be better. So we have to now stock up our masks once again. And this is going to protect us definitely, even in spite of being vaccinated. Whenever many people ask me now, next question, I'm sure someone would have asked, I'm vaccinated, why am I getting infected? Definitely, yes. When we started vaccination also, we have said vaccine will not prevent infection. It will only protect you from severity of the infection. And hospitalization is definitely reduced and the death rate after vaccination is quite less. So I've already told you about the face shield. You can wear a face shield with single mask. Otherwise, double mask with face shield or without face shield also is fine. And this is the PPE kit. Imagine from past 3 years, doctors at this in ICUs and ventilators, hospitals. Basically, doctors are like this, all decked up like this. But patients tell me, ma'am, with the mask, I cannot talk, I cannot breathe. So just imagine how many more years do you want healthcare workers to be in that uniform, fancy dress? Even we want to get out of it as early as possible, because for us also a lot of difficulties. And wearing that, most of them, they cannot even use washroom for 6 hours, because if they go, they will have to change. So that is the reason why I wanted this pic to be added here. At least have some mercy, if not on you, on your family, have some mercy on healthcare workers. Okay, the next one. Avoid trees. Yeah, next slide, please. So we have always said that avoid trees. Yeah, this is the once again about wearing mask. See, the people not wearing mask, infected person and uninfected person, within 15 minutes you are going to get the infection. It is actually 8 minutes. They're saying 15 now, but previously we were told to have a gap of only 8 minutes to another person if you're not wearing. But if you maintain a distance like 6 feet distance, definitely you will not. The infection spread will be very less. Whereas if you're wearing, both of you are wearing N95, you're protected for 25 hours. So that is why I just wanted this to be seen, see properly. See, some person not wearing, infected is wearing cloth mask, whereas infected person is wearing cloth mask. You will have 20 minutes time. You both are standing opposite to each other. You have, within that time, you get infected. So do not stand for longer hours with your friends and with somebody from other houses, other families. Do not go in the same car, crowded in the same bus, anything, even two-wheelers, one sitting behind you. It is not advisable to travel with person from another family. You never know. Someone may be positive in his house, or someone may be carrying in his house, and this person may be another carrier with asymptomatic. So you might get infected. So it's okay to say no to certain things now. It's okay not to share. It's okay to say no on physical contact. These are the things we have learned, and we want to maintain this because we want to see our friends for longer time. We do not want to lose our loved ones. So now if you miss out, it's okay. You can meet them for some more time later on. And meeting now at this time when the infection is at its peak, it might trouble them. That is the reason I am telling you. Okay, so avoid, next slide, please. Next slide. I think this is quite clear, very clear picture. Just avoid 3 C's: crowded places, close contact, and confined places. That is crowded places. What are the crowded places? We have gone soon after the second wave. Okay, when the count was around 250, 300. But when it increased also, we went for festivals, we went around, we went to villages. No, previous slide. Market, rallies, malls, and many other things we went. and close contact places, that is in the houses. When you go to visit your houses, friends' houses or family houses, you cannot maintain. Generally, people take out, like you are taking out your chappal, you take out the mask when you go to somebody's house. There also you have to wear mask and try to maintain the physical distance of at least 1 meter. Then you can definitely sit there, but not for more than 15 minutes. But try to avoid such places where there's not much of ventilation also, like confined in closed places like theaters, temples, and malls and marriage halls, convention places like that. Whereas this one, what I wanted to tell is close contact places include even marriage halls. So, and where hotels where you sit together with other people. So try to avoid that. You can bring takeaway is available, even if you don't want to cook at home. Of course, cooking at home is the safest way, but still we want to eat something different, something from outside, some junk food we want always. So you can always get takeaway is better, but sanitize, reheat it, sanitize your hands after touching that. And yeah, so next slide, please. A set of promises we need to make to protect ourselves, because we are safe, only our nation also will be safe. This set of things, 15 promises we need to think is: first, greet other person without any physical contact. No shaking hands, no hugging for at least few more years, according to me. And then social distancing is a must. Vaccination is a must. Promote people to take vaccination. If you find someone who has not taken a vaccination, encourage them to take vaccinations. And always wear mask, avoid touching your mouth, nose, and eyes without washing your hands. Wash your hands frequently as possible, and as regularly disinfect the surfaces which are commonly almost always touched, especially in offices and other things. If you're going, the knobs and taps are to be disinfected. Do not spit in public, and do not circulate any negative, unconfirmed, and unverified information on social media, because this I always say. And if you do not want to do good, do not do harm, because these material things definitely can get a lot of dilemma in people, whether this is good, this is bad, like that. Unless and until you get it from credible sources, do not give it to pass on this message. We all think that one message has come, let me pass. One video was going on which said that corona is not a virus at all. This flu is just flu. It is not going to cause anything. So things like that, you should stop at that. That message should stop at you. I think the wise receive the message, definitely it will stop at them. Avoid unnecessary travel when it's not required. Discourage crowd forming activities and encourage safety. Safety is the most important thing now. Seek information on COVID-19 from only credible sources, as I told you, and call the helplines 1075 whenever needed. Seek psychosocial support also. There are many groups which are helping. I think Rajesh is there. He's also running one psychosocial support group. So there certain groups are there which definitely help you if you are in anxiety, or if you are not understanding what is your present situation, or feeling very depressed. You can always call such helplines. We are also having, YFS is also having one helpline on that. And maintain cough etiquette, that is, do not cough or sneeze in your hand. You have to cough or sneeze in a tissue and wrap it properly, put it in a closed dustbin, or cough on your elbow. This is the cough etiquette we all have to learn, and I think we have all learned also. Some of us, hygiene is the best thing to follow. COVID, the positive thing COVID has taught us is hygiene. We have learned a little bit of hygiene. So do not stop that what we have learned before. Okay, so that's it. And do not discriminate anyone. See, you are COVID. Do not make the person feel bad. Without making him feel bad, try to avoid or try to tell him what he has to do. Take care of him. Call him from home. If anybody says, I've come positive, he's come to meet you, then you can go. You can tell him, I'll call you. I will go back home. I'll call you. I'll give you the helpline numbers. You also be like this, be like that. You can advise him properly if you know to. Otherwise, refer him to people who can advise him properly. So yeah, this COVID appropriate behavior, the CAB. Next slide, please. we all, these are again the repetitions only, but just little more I am elaborating on this. The same thing, maintain a distance of 6 feet, at least 2 gaj ki antar, and wash hands frequently, thoroughly, if soap and water is available. Otherwise, sanitize yourself every 1 hour. Even when you are at home, you have to do that. Wear reusable face cover, mask at all the time. Avoid touching men and use tissues that I have told you. And this is the same thing. 15 promises we need to do ourselves before going out. Every day we need to memorize the things what we have to do. These are the 15 things I have told already. From the moment you leave home to the moment you return, you will have to know the risks involved, like while you're traveling, while you're sitting in a cab or you're sitting in a bus. I think all of you know about all these things. Even in the office, out you have to maintain distance of 1 meter distance at least from each other, and then get up and do sanitization and washing your hands. Do not share food. Do not share your pens, pencils, computer, and all that. If you're saying sanitize first, use it, then again sanitize. First sanitization is to protect your friend. Second is to protect yourself. So anything you're touching someone else's belongings, definitely you have to do. And there should be a proper ventilation. Windows should be open and fan should be running. Those proper ventilation. In open spaces, you can always meet your friends, like park, public places where there is open air, a good air circulation. There you can always meet your friends, meet your family also, like next family. If you want to meet, you're not able to meet, you can call them around and do. But don't avoid crowding, as I have already told you. So these are the things that we have. We have to again think morning when I'm going out of the house. Yes, these are the things I have to follow. Then come back and follow certain protocols which we have discussed before, and most of you also know that you have to go directly to the washroom, then change your dress, then only you go to your kids, and then aged people in the house. Do not go to them directly. Then dispose the masks properly. So, and these are things. And for everything, I told IV SMS. Now we spoke about vaccination, 2 doses. Now the 3rd dose is being done for above 60 years and for healthcare workers. That is a gap of nearly 9 months we need for the 2nd, 3rd dose. Immunity. When it comes to immunity, what comes? What is health? Health is well-being. Physical, mental, and spiritual also. So in that, a healthy lifestyle only can bring good immunity to us. That is our resistance, how much ever we have to fight. What is our strength to fight any infection, not only COVID, corona, any other infection, malaria, tuberculosis, or anything. What nowadays I'm seeing is people are coughing, corona, COVID positive or negative. After some time, they start coughing, continue to cough even after 10 days. We need to get them tested for tuberculosis because there's carrier. So to get tested is very, very important if you continue to have the symptoms for a longer time. So dengue and tuberculosis are co-associated with corona. And immunity, how to improve our immunity? Next slide, please. Only healthy lifestyle, arogya. This is, of course, food and ahar, vihar, vichar. All that is very, very important. Ahar is food, whatever we take. Never skip meals. Always do not starve. Have a proper breakfast. Have a complete diet, balanced diet. Chew food properly and limit fast food, junk food. I think last year we have done that, and we can always survive without junk food. Definitely, we have learned that. And include fruits and vegetables in your meal, and drink plenty of water. And exercise, never ignore exercise. At least 25 minutes exercise every day or at least 5 days a week definitely improves strength and your endurance. Your resistance and your immunity improves with the exercise. Bones and muscle become strong. And if you are overweight, try to reduce your weight. If you are having any comorbid conditions, try to continue take the medicines and take care that your things are balanced, like BP is under control and sugar is under control with medicines. Then avoid weight gain, reduce exercises, usually reduce anxiety and stress also. It increases our confidence and self-esteem. And enjoy this one. What is it? 8 to 9 hours of sleep is very important to improve our immunity also. So sleep is also equally important. Rest is very important in this age when we are doing work from home. I'm seeing all MNC people have no time limit at all. They work till late night. They get up late. They get up very late and sleep very late. So that is not the healthy lifestyle. So in this healthy lifestyle, one more is spiritual contentment I always include, because most of us have forgotten to be content and be happy and make others happy, like our IFS volunteers. Everywhere I see volunteers, I'm really feel proud to see our young volunteers who have done so much during this COVID time. And hats off to you all once again. And yeah, this is it. I think this completes my thing. Thank you so much for listening. And I hope I have been clear in a few things at least. Thank you.
Ma'am, there were few questions to be taken up, ma'am. Somebody on the group was asking if they are using N95 and is it washable? If so, how many times you can wash it and reuse?
Around 5 to 6 times it can be washed. It can be microwaved also.
And you said that double masking is important. So when they go for walking, so they feel it very suffocated. So what is your suggestion on that?
Yeah, when you're going for walking, actually, if there are nobody in the park, you are the only person walking, mask is not at all required because not airborne infection. But only by chance somebody is coming near you, then you can always have one surgical mask, which is better. One surgical mask.
Ma'am, when it comes to the vaccination part, somebody has asked, when can we take a vaccination after a recovery from COVID positive?
Yeah, generally about 3 months later. 90 days. 90 days after the recovery.
Okay. One more person has asked, like, in spite of taking vaccination, there is an infection that they're being said positive. Why is it so?
I think I answered this while during my session itself. You must have got the answer, but still I'll tell him. Vaccines do not protect you from the infection. Vaccine protects only from severity of the infection. Definitely now Omicron is mild. Most of us are feeling that it's because of the vaccination also. We have got some kind of herd immunity, definitely. That is the reason why it is less also. I mean, only time can tell, but most of us are feeling that it is because of that. And all doctors who have got infected during the second wave, even now some of them have got infected, they've all received the third dose also, but still the infection has been very mild. And whoever admissions, whatever we are saying, 1% admissions, they're all unvaccinated people.
And what's the difference between a surgical mask and a N95? Ms. Supriya has asked this question.
Surgical mask has a very porous material. That is the only thing here. And this cannot protect so much. This is generally used only in the OTs. No, this is quite a porous one. And you can breathe in properly with this. It cannot mask completely. Say around probably 50% it can mask the viruses. It's mainly only because of other infections that we might contaminate the person during OT. Whereas this N95 is made of different material. It's not that porous compared to that. And it can block 95%. That's what claim. But we feel it is around 80%. These regular ones are like that. And a cloth mask should be 3-layered cloth mask, which have some filter inside, which can be removed. Some cloth mask can be made like that also.
Is sterilizing the cloth mask important?
Yeah, you can just wash it. As soon as you come home, just put it in a soap solution. Just dip it. Next day after 24 hours, you can just wash it. No need to sterilize. Because soap water, you can remove the virus. That's what we are seeing, no? We are washing our hands for that only. 20 seconds of washing can remove everything thoroughly and frequently. 20 seconds. I always tell, yeah, happy birthday twice you say. It is 20 seconds over. Yes?
There is another question that there are several cases in third wave from people who have been unvaccinated. So they want to reconfirm whether it is right or not.
Yes, definitely. It's not just unvaccinated, vaccinated people also are getting infected. But the severity is seen more in unvaccinated people.
And Sharat asked a question, is it okay not to go for RT-PCR if symptoms are not severe, as long as I'm unable to take care of myself?
He is able to take care of himself. He is able to isolate himself. Yes. But to get the data, that is required. Or sometimes you never know if your infection becomes more, or somebody in your house needs admission suddenly. Some cases do not show any symptoms. We have seen that also. Contacts do not show any symptoms sometimes. That's why contacts previously we were doing on 5th day.
So
RT-PCR for contact.
getting antigen test at home, that's the card method. Is it advisable?
Because it's permitted now. It's permitted, but there are some apps to upload your report. If you do that, it will be good.
Thank you, ma'am. Any questions from the audience? Ms. Prema KS asks, RT-PCR test, does it indicate Omicron or just the corona?
Oh, again, I'm saying you, Omicron is also corona. It is just a variant. Delta like Delta plus. Idu one magu. Corona the magu. Delta plus, Delta, Omicron like that. That's all. They're all from corona only. RT-PCR detects corona. We do not have anything to detect Omicron immediately. It's only gene sequencing, which is not done for everybody, as I said. Even in the reports and media and all, you must be seeing 1,000 cases, we say 200, 300 Omicron. But yesterday only, ICMR has given, like ICMR means Indian Council of Medical Research, they have approved one kit, that is a Krivda kit, which is going to, maybe in future it's going to come. This detects Omicron in 45 minutes. That's what they claim. Some Chennai technologies, Kriya technology, something. They have approved this, but anything that is approved will take some time to come to market. Until then, I said no, Omicron, to differ, why do I differentiate? It will tell you, the disease itself will tell you. The progress of disease itself will tell you whether it is Omicron or Delta plus.
Ma'am, there was one more question from YouTube viewer. Can N95 be used in double masking?
Yes, of course, it has to be. But with surgical mask inside, not cloth or 2 to double, 2 to N95. I said, no, you should mix the mask.
Yeah, thank you.
Thank you, ma'am.
There's one more question. I think it's for fun. Should we wear mask during having food also? Diksha, if possible, you can.
No, how we can avoid is sit separately. Keep a distance from your friends. Don't sit with them to have food. That is the reason I said avoid 3Cs. That is a hotel also, where you sit very close to each other, or in the offices also, you'll have to maintain. That is why offices have made 50%, 50-50 rules. You have to sit far. Do not share food. We all have the habit of sharing food. That's very nice Indian culture, that is. But that should be avoided now. That's all. We cannot share food. Sharing is no more caring.
Going back to square one, ma'am, there is one question. Is COVID really originated from China or it's a biological weapon?
Let us leave this to, I think, politicians or someone else. But still, I think it's kind of biowar only. We always feel that.
How effective is this booster dose, ma'am?
Still, we don't know. It's just being given, and everywhere else they have given. It's definitely booster dose is required for most of the vaccines, especially so for the virus. We see in India only we don't take adult vaccines. Everywhere else they take. Flu vaccine is taken every year. Booster is needed. Even for children, we give booster. No DPT when we give booster. Booster again because the antibodies might reduce after a certain time in the body. This will trigger the reaction once again. T cells to produce more antibodies.
And Miss Vandita asked, ma'am, if we don't get tested for fever and cold, still can we take a booster dose?
No, if you are having fever, it can be anything, whether a COVID or anything, you have to postpone your taking your vaccine. Definitely. If it is not COVID, you can take after 15 to 20 days. That is why we asked you to get tested. Because you will have more reaction, severe reaction, adverse effects after the vaccination will be more if you are already having some antibodies.
Paranjyoti madam is asking, Doctor, how to safeguard children?
Hi, Paranjyoti madam. Yes, how to safeguard is first is vaccination and following all the things, SMS, whatever we are doing, and don't let them play with other people, even though they are not from other families. Don't let them play in a common play areas. That's the way. And then give them good food, definitely. Balanced food and with some zinc and vitamin C supplements.
Mr. Karan is asking, is Omicron more fatal than the original one?
What is original? The corona?
COVID?
No.
Yeah.
This whole webinar was on that. It's because it's mild, but it's highly infectious. What I'm saying is highly infectious. One person can infect more than 35 people, 30 to 35 people. Highly contagious disease. Immediately you get the infection. Whereas the severity is less with Omicron. What we have seen with Delta plus, of course, the severity was very, very much. So Omicron, the severity is less.
Miss Seema asks when it will all be ended.
God only knows. It is in our hands also. Like, the third wave we are reducing, it will be there. It will not end. It is there to stay. Like any other disease, swine flu, dengue, malaria, tuberculosis, whatever have come and gone. Just like that. Even this has come, this will come in waves, means it is affecting large number of people at the same time. That is only wave, nothing else. Wave is not something, it is coming from outside. We are causing the waves. So if we are careful, definitely the waves will reduce and it becomes an endemic. When it becomes an endemic means only one particular part at particular time will get. Like almost like now UK and other countries have seen the third wave few months back, like 3 to 4 months back. We are seeing it now. Probably this gap will increase further and this becomes an endemic. Like this is an endemic at this time. Definitely it will come during this time. Like that we can say. The number, of course, the spread and transmission is with us. We have to control and follow SMS. Definitely.
Prema madam is asking, booster for Covishield and Covaxin are both separate or unique?
No, whoever has taken Covishield should take Covishield only. Whoever has taken Covaxin before should take Covaxin only. Do not confuse your T cells.
Yeah. And she also asked whether this booster dose is being administered both at private or public, government hospital. I would like to answer this. If you go to a government hospital, it will be free of cost. And if you are going for a private hospital, you need to pay the cost. So the choice is yours.
Yes. And one more thing is here, many private hospitals are not giving booster doses. Because the turnout is quite less now, because cases are more, people are not going too much. But government hospital, it is a very easy walk. You just go, take and come. They're not asking for many, forms and all that stuff. It is free also, as Dr. Nirupama said. Thank you for that. Thank you for answering that.
And Ms. Manohar asks, his kids had cold and fever since 2 days, and now even he has cold and cough. So could this be a COVID or a common cold?
As I said, you wait for 2 or 3 days. Take just symptomatic treatment. If it's not coming down, please get tested. Only that can confirm.
An interesting person is there in our call.
Isolation is very important, sir. For everyone, what I'm saying, the first thing I do, Rohit also had asked me several times, what do I do, ma'am, when I get cold? First thing is isolate yourself. Start taking medicine, but isolate yourself from family. It's like even isolation now for Omicron is less time. Why is it less time? Because the infectivity, the time taken for you to spread the infection to another person is reduced. That is the days. It's come up to 7 days now. That is why the isolation is only 7 days. And people in the house, positive people are there, please quarantine yourself for 5 days at least. That is the government guidelines might change. So one of the rules women follow women when we say wash hands, and then in that obey the government directives, whatever are coming, please get to know that now and then. Keep a watch of that.
Ma'am,
Yeah, tell me.
Mr. Virat has a question. Is it better to buy a use and throw mask or a reusable mask?
It's actually reusable mask is best, but we cannot use two reusable masks, like, two cotton masks. Our cotton mask with N95 will be too thick for us to breathe in. So that is why a surgical mask for time being, when there is a lot of infection, better to take it. Of course, we are all eco-friendly people. We don't want to spoil us, but we have to do it. Our PPE is also plastic. We come back to plastic. They said no. When he told us Earth has cursed us, we have put so much of plastic on the Earth. The Earth has cursed us that we are wearing plastic to protect ourselves.
There's one more question from Supriya. Even people who are vaccinated with Covishield has to take boosters?
Yes, of course. Both Covaxin or Covishield, both need booster. About after 9 months of the second dose.
Mr. Virat asks, which is the best diet for immunity against COVID?
Everyone knows it. Even children will tell me now. Vitamin C and vitamin D. And people are gulping like anything nowadays.
So
and
natural way is using lemon.
Lemon. Don't go for only kiwi and other exotic fruits. You can buy gooseberries also, or lemon also, which has vitamin C, or guava, anything. But include fruit. That's why I said include fruit and vegetables in your diet. That itself will give you good immunity. And a positive mind is more immune to anything than your food and diet. Positive mind and be happy. Keep others also happy.
Yeah. In the interest of time, request Nirupa ma'am to do the closing on us, please.
Yeah, thank you, Arishi. On behalf of YFS and DFS, I extend my heartily vote of thanks to our chief speaker, Dr. Jyothilakshmi Madam, who really spared time from her busy schedules to grace this webinar. Ma'am, today we had a real good opportunity to hear your thoughts on the COVID, its variant, vaccination, and all the COVID protocols. I'm sure going forward we will use your words to understand COVID better. I also thank Arpita, who have been budding at DFS to introduce the entire team. And I thank Harish ji for managing the entire program here. And I also thank all the viewers and the volunteers who have supported to make this webinar more successful. Thank you all. Thank you very much.
Thank you all. It was a great opportunity.
Yeah.
Thank you.
Before we
Namaste to all of you.
Close, if everyone is fine, we can have a group photo with the videos on, please.
Yes.
Okay, many more to come on. It will be a very quick one, short and sweet. I have a few more. Yes. Naresh, Seema ma'am, yes. Manohar, yes. Okay, we are all set to go. Basavantanuja and Manju. I think there are 2 people who are in the screen and yep. 1 second. Thank you very much. See you all. Bye-bye. Take care.
Good evening.